Okay, great. Hi, everyone. Welcome. We're going to wait a couple of minutes for people to get started. Hi, Gabrielle.
When you say be welcome, you can say sejam bem-vindos in Portuguese. In Portuguese.
Sejam bem-vindo.
Yes.
Hi, everyone. Okay, so for the sake of time, I think it's best that we get started as soon as possible. So welcome everyone to our second installation of the Customer Journey Spotlight, where we invite real customers, such as dentists, DSO leaders, lab technicians, patients, dental nurses, to give us deep insights into how they practice dentistry. Today, we have a very special guest, Dr. Daniela Aggio. Dr. Daniela Aggio is a world-renowned specialist in orthodontics and restorative dentistry and a director of the multidisciplinary practice Aggio Clinic located in Sao Paulo, Brazil. Dr. Aggio is also a social media maverick with over 25,000 collective followers across various social media platforms, where she educates her followers on leveraging digital technology to achieve superior clinical results. As a practicing orthodontist, she is knowledgeable on multiple orthodontic solutions, not limited to SureSmile, Invisalign, clear aligner, Essex, aesthetic aligner, Total CAD, Smart aligner, Click aligner, eRock, and Compass. Daniela is a prominent Dentsply Sirona KOL for CEREC CAD/CAM systems, SureSmile, CEREC Ortho, and a beta tester for CEREC Ortho. She is also a faculty member for Dentsply Sirona Academy, specializing in CEREC Ortho, and mentors other clinicians worldwide. We're so happy to have you here. And just so you all understand, the format will include a 45-minute presentation from Dr. Aggio, followed by predefined questions. So Dr. Aggio, welcome.
Thank you so much. It's a pleasure to be here with you. Hugs from São Paulo, Brazil. I am here with my mentor, that is Daniela Souza, that I love in Dentsply Sirona. Thank you, Dani. And it will be a pleasure share my experience with you. Thank you.
All right, so we're going to get started with the presentation. And you guys let me know if the sound and everything is working great.
Thank you so much for the invitation to be here. It's a great honor to be here with you and participate in this very special event, and to be part of this big family that loves digital dentistry. When I started working with Dentsply Sirona, I suddenly found myself in a vast universe. And when this marketing campaign was created, I really identified myself with Dentsply Sirona, with them. I feel that I have the condition of possibilities of working as I want, to do it my way. When I started with Bluecam, working on the Connect system. I had only the scanner, and I was happy with that. Currently working with the Connect system, you can work with prostheses, with implants, with orthodontics. You can work with several specialties. So today we have a lot of possibilities with the Connect system. However, when I started, we could work only with prostheses and implants. Nowadays, working with the chairside system, for me, was a game changer, especially because I can really focus on my patient's needs. Why did I need to go beyond Connect? Because it was a demand from the patients and from my team, which was precisely to have a system that offered me a complete digital workflow. Then it was time to invest in milling machine, and I developed a workflow in such a way that today we have all types of treatments: prostheses, implants, and orthodontics using chairside. For example, this patient is a practical result of this integration, CEREC ortho, and aligners. Bruxism patient, thoracic arch, dental wear. A treatment with aligners was finishing with veneers was performed on the 10 upper anterior teeth. Minimally invasive wear was finishing with CEREC prosthesis designed and made it in the clinic. The happy face reflects the patient's satisfaction. Integration for me is to go beyond CAD/CAM. It's working not only with CEREC Ortho, ShareSmile, but also working with the company's consumables because they are complementary to the digital tools. Following my integration history, when CEREC Ortho arrived in Brazil, I was one of the first to work with it here. And for me, since I am orthodontist, it was a great achievement because digital orthodontics was finally a reality in our lives. Today, children and adults, all my patients of all ages who use aligners are scanned with the CEREC Ortho software. And the CEREC Ortho, step by step, offer me possibilities to go beyond traditional orthodontics in terms of quality and execution. Scanning with CEREC Ortho is easy, fast, and precise, and together with the accuracy and speed of PrimeScan, I can tell you that today the performance of CEREC Ortho is much more perfect with the use of PrimeScan. So I found myself working in the universe of digital dentistry using PrimeScan and CEREC Ortho. Why? Because I have been working with aligners for 18 years. And during this time, I have worked with many aligners systems because I was always looking for new possibilities and innovations. However, the universe of digital orthodontics wasn't sufficient because in my workflow, I had the entire sequence, step-by-step scanning, model analysis, treatment simulation, but I didn't have any planning software nor aligners. Today, with ShareSmile, it is a reality that the orthodontist has a complete and precise Dentsply Sirona workflow. Working with Dentsply Sirona imaging equipment with panoramic X-ray, lateral ceph, and CBCT scans has also revolutionized my clinical practice. Why? Because the same patients who will be treated with aligners started their treatments with me by doing a general clinical treatment that usually involves many odontological specialties. This is the power of the integration. 100% digital, thin and practice, diagnostics, planning, and mechanics. For example, let's see a case for you to understand how I work with this integration in my clinic. This is a patient with a genesis of the upper lateral incisors, where the proposed treatment was the total rehabilitation of the upper and lower arch. This is a patient with a genesis of the lateral incisors. And in the region of tooth 1.2, it was possible to install and implant. The same was not possible in this region of tooth 2.2 because of the inclination of the roots of the teeth around it. The planning for this case started by increasing the vertical dimension and the implantation of the prosthesis on tooth 1.2. Scan with prime scan and used articulator. Fixed prostheses with full crowns were made between the canines and the laterals. To the other teeth, we planned single crowns that were all made in the serrature side system. To evaluate the spaces required for the new vertical dimension, study models were created in semi-adjustable articulator in central relation. Once the new vertical dimension in centric was established, the model created in articulator were scanned with prime scan and sent to the lab where the dental technician did all the virtual prosthesis planning at exocad. And then printed the upper and lower models with the new morphology and desired vertical dimension. For the temporary installation of rehabilitation with bisacrylic resin, silicone guides were previously made for the transfer of the patient's new occlusion model. Note that at the end of the entire simulation, the patient immediately will be able to evaluate the new aesthetic and functional morphology. In addition to the entire aesthetic and functional design benefits, the entire periodontal system will be preserved with the individualization of all teeth. Note that fixed prosthesis was made with full crowns on the upper central incisors and point on the upper lateral incisors, joined to the canines. The importance of working with orthodontics already prior to the aesthetic and functional rehabilitation of the smile is that the treatment is not done in parts. The treatment of the patient is not divided. It is created in one step. This helps very much in the logistics of the treatment because most of the time the treatment is done and following it, the patient goes to rehabilitation. Normally, the rehabilitator was to change the position of the teeth, saying that the tooth could be in a better position for the creation of the prosthesis. Working with integrated specialties, the benefits will always be to the patient. Well-positioned teeth are ideal for minimally invasive dentistry. The patient will gain a lot in dental preservation because once you have placed the tooth in a pre-agreed position with the rehabilitator, minimal dental wear will happen. With the rehabilitator and the orthodontist working together, we have the best results in treatment integration. Normally, the patient goes to the orthodontist because he wants a more beautiful smile in a better function. That will be started by the orthodontist and will be finished by the rehabilitator. In the first diagnosis, the rehabilitator and I decide to increase the vertical dimension sufficiently. With this increase, we improved function, aesthetics, and stability. In teeth, that were modified during all previous orthodontic treatments that were not successful. The centric relationship creates a more stable and functional orthopedic position to favor the manufacture of prostheses ideal for the patient's new bite and occlusion. We increased this dimension to be able to reconstruct the anterior teeth in a more satisfactory way. And also to enable a better occlusion, since the patient has many dental agenesis, which prevented the perfect fit only with orthodontics. And since there is a need to perform rehabilitation, it is better to do in a centric relationship that favors the patient's maxillary and mandibular orthopedics.
Tall and tan and young and lovely, the girl from Ipanema goes walking, and when she passes, each one she passes goes, ah.
There were 5 orthodontic treatments that didn't work with other professionals. The big mistake was the orthodontist had a unique and exclusive view of orthodontics. When this patient arrived at the clinic at the time, I told her, your case is integrated and many specialties are planning it with me. You will use orthodontic aligners and finish your treatment with prostheses and implants. And she asked me, why didn't other doctors show me this plan before? Today, digital dentistry allows us to integrate all specialties. Orthodontic is amazing, but normally it will need to be complemented by other specialties. Because of this, integrated planning is the key to success. In this clinical case, this patient also has bruxism with a thoracic arch. Observe the canine guides, she completely lost the previous guides. A thoracic arch. The case was treated with aligners. A gingival plastic surgery was done, and the mock-up transferred to the mouth, the choosing of the color. Minimally invasive wear was performed on the patient, and this is the final result of the 10 prostheses in the upper arch. This is the software CEREC Ortho 2.0. With the different color dots, you can check the occlusion, overbite, overjet, check and edit the calibrators so that you can get excellent results in model analysis, transversal, and symmetry measures. The treatment simulation tool, so designed by us orthodontists, is amazing. With it, you can perform simulations with and without extractions, check occlusal contacts during orthodontic movement. This treatment simulation is excellent for talking to the patient about the diagnosis immediately after scanning. This is the scan workflow. Scan the lower arch, the upper arch, and the occlusion. Model axis. Teeth marking and separation for model analysis. You have the option of create the file with or without a base. We check the orthodontic classes, overjet and overbite, the width of the teeth, the arch length, the transversal measure, and the symmetry measure. Treatment simulation. I can use the Connect software and export the file in STL or send the file to partner labs. Or use the CEREC Ortho software to create model analysis and treatment simulations, export the file to partners, companies, and in partnership with SureSmile, use the platform options. Open any digital labs, in-house aligners, Orchard site, diagnosis, and consultations. The two portals, SureSmile and Connect Case Center, need to be linked together. Log on the Connect Case Center, link the portal, SureSmile, and link. After the scan is done and the model is created, export face, aligners, SureSmile, add the cards, enter Connect Case Center login information, select the patient, gender, submit card. In Connect software, before the scan, in the administration phase, select jaw, scan, and aligner and confirm with OK. After the model has been calculated, you can ignore steps link trim area or draw margin and go directly into the Connect phase to send the case. Connect phase. Enter Connect Case Center login information. Enter order data. Enter necessary data and submit case. SureSmile, patient's gender, insurance type, return date, additional order information, and submit card. Our model is do it your way, right? So with the SureSmile platform and all equipments from Dentsply Sirona, the doctor decides how they want to work, and they have the power to decide in their hands. I have worked with around 20 aligners companies for 18 years. And I can tell you, our platform is complete. Working with predictability and security is fundamental to my integrated planning, because the platform doesn't just show me the movement of the crowns. I can see bone, I can see roots. This is essential for me. Best-in-class software tools, Smile, aesthetics, occlusion, fit and function, bone and roots, health. Less time, fewer visits, better finishes, compliance, and health. I can work with labial and lingual fixed appliances, indirect bonding, aligners, surgical planning, restorative planning, and hybrid treatment. One platform, many options. Diagnose, plan, design, administrative features, keep things, and track with improved practice communication and workflow integration. What's new for the SureSmile aligner? What sets SureSmile Align therapy apart? Based on the biomechanical fundamental of tooth movements, fully visible and available to the clinician, automatic and convenient multimedia platform through Smile design, CBCT integration, restorative simulation, multiple products, do it yourself, select, or comprehensive. Variable trim heights, expands, and properties of the aligners, improve and effectiveness of expansion, bite opening, and torque, reduce the need for attachments, greater efficiency due to fewer refinements, advanced diagnostic metrics through 3D premium model, root, bone, and gingival analysis. How? Vertical and horizontal registration, occlusal plane, midline, and smile arch. Leads to precise smile design, precise occlusal planes, and precise occlusal with real-time simulation. Which model is correctly oriented? The patient face integrates to the digital model is essential to establish the correct occlusal plane position. Does it change your plan and smile design? Does your model show roots in the bone? Ours does. The roots in the bone. See? Yes. A real digital patient and platform with the only anatomically precise 3D model available anywhere. Better smile and teeth in bone. Start registering a new patient, upload the scan data. You want to include CBCT, click on the option CBCT Premium, upload images, do the dental examination, select the package type, and make the payment. Why is integration important for me? The success of the integration with CEREC, Ortho, and SureSmile is the first planning, so the doctors need to have vision and knowledge of all softwares, specialties, and know how to direct the treatment from start to finish. In this first case, note that the patient has a missing molar, posterior crossbite, dental crowning, and diastema. The main question was, why are my teeth opening and my bite no longer the same? With the complete orthodontic documentation, plus scanning with CEREC Ortho, the information is sent to the SureSmile platform, and the doctor selects the type of package. Then the great moment of mastery begins, which is precisely planning. Some patients say, if I have all the aligners and the complete treatment already, why do I need to come and see you every month? Well, as I said, success is in planning. Poorly planned treatments deliver poor results. But planning is only the first step, because I need to observe the progress of the treatment closely and update the plan as time goes by. So, doctors and my friends, welcome to the world of digital orthodontics of excellence with aligners. On the SureSmile platform, we have an incredible range of tools for diagnosis and planning. In the CEREC Ortho software, I perform scan, model analysis, treatment simulation. However, it is only a preliminary simulation. The planning itself will be done on SureSmile. In the software, you have a preview in several different positions. Occlusal contacts are viewed before, during, and after the move. And these tools is extraordinary because I can see premature contacts with the arch in motion. The SureSmile photo tools allows me to view the patient's face integrated with the digital model. And viewing the arch individually or in occlusion makes all the difference for me. Why? In the lead trace tool, I can see the real dental exposure in relation to the patient lip line. And the pupillary line and the midline of the face integrated with the digital model improve my planning of midlines and how much I need to move the teeth to provide an alignment of these central lines. The clipping plane navigation tool allows me to synchronize and view internal images and sections, very similar to the tomograph, providing better security for planning. The front and back grids are used to design the smile, arch depth, arch width with measures of excellence. Check how the contact points, the discrepancy index, and the tooth width. Helping me plan the IPRs, cusp tips, margin reads, central grooves, buccal grooves, incisal edges, tooth axis, and facial axis system. And in more details, the lip line trace show on both arcs. You can view the arcs with gum and without gum. This is a table of displacements where the doctors has absolute orthodontic control. In the global registration tool, we analyze transformation, translation. In the global registration tool, we analyze translation and rotation. In the build-up and IPR tool, I can add restorations and change the dental shape with predictable guides for future dental eruptions or for future restorations. In the bracket placement tool, it is possible to create an orthodontic plan with indirect bonding and brackets. In the measures tool, I have discrepancy and Bolton analysis. In the staged model phase, we have a step-by-step sequence, for example, IPR planning and attachments. And note that we can see IPR attachments and stages of the treatment on a timeline. The software itself already suggests the location of the placement of the attachments and the IPRs. And the models are exported in STL sequentially and sent to the 3D printer for prototyping. Observe here in the image a sequence of the upper arch and lower arch. This is Drufomat pressure machine used to manufacture the aligners. With Drufomat, I can make whitening trays, aligners, sport protectors, and others. This is the A6 plastic with many different measures. Well, the next step is to cut out the aligner and polish in 3 stages for an ideal finish. And the sequence of aligners is finished with excellence. It is necessary to have a high quality control since the cuts is not performed by laser as in the factory. So it is necessary to pay more attention to these steps. These are Inter-Proximal reduction files with a sequence of different colors and thicknesses that can be used according to the sequence of IPR planned in the software. These files can be placed on a manual support, and the doctor can simulate the movement for wear or with contraangles in a uniform and mechanized way to perform interproximal wear. The success IPR is sure to deliver spectacular results. The next step is the package with the sequential labels and of the aligners, and the therapy with the aligners begin. Instructing the patient to use properly for 22 hours daily and periodic visits scheduled according to the preference of each doctor. My friends, this clinical case is an example of integration. With traditional orthodontics, I need to finish the orthodontic treatment and then calculate how much space I would have to finish an implant or an implant prosthesis. Today, with the predictability of SureSmile, it is possible during the orthodontic treatment with aligners to perform the surgical part of the implant and with the CEREC software to design the prosthesis. Create the implant surgery guides, mill the guides and design the implant's prosthesis using CEREC. So here you can clearly see the step-by-step of the prototype models programmed by the orthodontic software SureSmile and the final result in upper and lower arcs. I can calculate it and have the predictability for the implants. In this image, you can see the start and the end of the case after orthodontic treatment. Is it a case of integration? Yes. However, the aligner made all the difference. Not only the aligner, but also using SureSmile. Why? Because SureSmile allows me to work in many ways. For example, working with CEREC Ortho, I can prototype my models, eliminate plaster models. I can create guides for transferring brackets, vestibular and lingual. I can make aligners or order aligners directly for headquarters. I can work with snoring and apnea device, bruxism plates, orthopedics and orthodontic appliances, implant surgery guides, and other possibilities. CEREC completes a digital workflow that for me is fundamental. For me, my team, my clinic, and for my patients. So at my clinic, I work with PrimeScan, with Connect, CEREC, Ortho, and in Lab 2, with CEREC Prime Mill, with Speedfire Firms, and finally, SureSmile, which totally completed my workflow. However, the secret to success in the integration planning, it is not enough just to work with integration. We need a leader doctor at the clinic to coordinate the integration process. Why? Because the team has to speak the same language. Everyone has to be integrated with digital orthodontics. The question that I hear the most is, can this aligner with this thin plastic move my teeth? Well, this is the magic of planning and integrated knowledge with aligners and Dentistry Sirona systems. In addition to do-it-yourself, it is possible to work with full aligners, where the planning is done by the technicians at the headquarters, and the doctors receive all the sequence aligners in a quick and practical way. Once the diagnostic model has been generated, the diagnostic planning done by technicians is sent to the doctor that suggests the necessary changes according to their clinical preference. So, What is the difference between do-it-yourself and full service? With do-it-yourself, the doctor does the simulation and creates staged models for aligners. With full service, the digital lab does the entire process from start to finish according to the doctor's prescriptions. Do-it-yourself and select is changed per aligner flat fee. Is a clinical case of open bite and a thoracic arch. You can see the first photos and the image of the virtual model, plus the images required on tomography. The predictability of root movement is in the predictability of root movement in the bone is essential for the safety of the dentist and the patient. Note that in the current simulation, the position of the roots in relation to the maxilla are unfavorable. By connecting the images with the face, it is possible to visualize the roots and soft tissues. See the difference of the final result with the movement not focused only on crown's movement, but on crowns and roots movements in relation to the bone. Observe the roots before and after the treatment. The cut can be performed in many ways. The choice is up to the doctor. The cut can be simulated in the software itself, and the doctor can select many cuts lines, such as a scalloped or a straight trim line. There are several updates, software tools, and improved planning performed, such as the placement of points, the dynamics of attachments, IPR and stagings, the possibilities of gluing buttons on the aligners or teeth, fully personalized shapes and size of the attachments, adjust cutouts for bottom and slits, show trim line, scallop trim line, and missing teeth or gaps. And now, Sure Smile automates blackouts on every order. Custom-made attachment shapes and sizes. Restorations provides a guide to space management, provides a visual to the patient of the ultimate outcome, quickly allows to the widening of peg teeth or the placement of a point, and multidisciplinary collaboration. Evaluation of tooth size and the restorate simulation teeth size and measure. This is the new practice integration. One simple path to success. Create an account, complete online training, complete practice training, complete setup training, community and education. Sure Smile has a very strong clinical education community, and with the Sure Smile portal, doctors have access to high-level information from basic classes to the most complex information. Welcome to our universe of integration, where I repeat once again that clinical practice and staff need to be aligned. It is necessary to maintain excellence in scheduling and consultations. Diagnosis and planning must be followed up one by one, and the 100% digital workflow closes a circuit of success and many achievements. That's how I work in my clinic, and I wish you all a lot of success. Welcome to the integration universe of Dentsply Sharona. Thank you so much.
Thank you, Dr. Aggio, for such a passionate and a clinical exploration of how you integrate digital technology in your multidisciplinary practice. I have some questions for you, and I'm sure that the audience is as pleased. I see lots of applause. So let's just jump right into the Q&A section. So just a question for you. You seem to have fully dived deeply into digital dentistry. Why did you decide to switch to digital dentistry? And how did the successful trajectory happen until you became the KOL speaker for Dentsply Sirona?
I decided to transform my clinical practice. For that, I need a more efficient, certain, and practical digital dentistry that really met my hopes. I have clients of many ages, but my adult patients are executives who are looking for great treatments in optimal time. So, working with CEREC for me was a revolution. For example, today I can finish a crown treatment in a few hours in a single section. In orthodontics, the doctors can scan, create a complete orthodontic documentation, simulate treatment, all that in a single visit. Today, I can say that the financial performance of my clinic has increased 100% with CEREC technology. Today, I have more time to take care of business, to manage my staff, to be a teacher at the Dentsply Sirona Dental Academy nationally or internationally, to work as a KOL with ideas to improve our clinical practices, and to serve my patients with the quality and care they deserve. And this success was the result of an evolution, much study, improvement, and dedication. I started as a student. After that, I became a teacher, mentor, ambassador, KOL, and today I feel part of something bigger at Dentsply Sirona. I am a doctor in love with Dentsply Sirona universe, and I feel professionally accomplished. Thank you.
Yeah, I mean, I love how you talked about digital dentistry has given you more time to invest in the things that you love to do for yourself, for your love of teaching and mentoring. And that's kind of what we aim to do, is to create the space and the efficiency to allow space for other things. So we know that you have a lot of experience utilizing different type of orthodontic products. What are the main differences, would you say, for SureSmile in comparison to the other systems?
The fact of being an orthodontic platform, not just a software to plan and deliver aligners. I can choose how I want to work. I have complete control with this technique. I can choose to work with brackets, aligners, and both. I can plan orthodontic surgery, integrate X-ray, CBCT, scan, photos. I have the possibility to visualize crowns, bones, and roots. The sum of so many benefits completely amazed me, and mainly because it completes my digital workflow. Because I start my planning with X-ray, CBCT, and intraoral camera images. And I create a diagnostics with a treatment plan. After that, the patients met all my specialists who work with digital dentistry, all in its possibilities. That's why I can assure you that working with CEREC and SureSmile, in my experience, was the missing piece to complete my workflow.
Great. I mean, we just have a comment here from one of our team members who said she just started her Sure Smile treatment this morning and couldn't be more excited after listening to your presentation. So that's really great to hear, Anna. And so another question for you. Let's talk a little bit about what was the impact of using integrated technological approach to your overall clinic, not just in orthodontics, but what's the general impact?
So today, my patients love aligners, scans, próteses, implants made with CEREC chairside system. My professional career was always linked to digital dentistry. So patients come to my clinic and are amazed by our practical, fast, and precise workflow. Because of that, I have many more patients focus on digital dentistry with aligners. And this success in results of the integration of all specialties in one place. At my clinic, besides próteses, implants, orthodontics, which are my flagship, I also work with CEREC in endodontics, periodontics, surgeries, among others. And that's why patients don't come to my clinic for a simple odontological appointment, but they enjoy an odontological experience. I learned with Daniela Souza this. They enjoy an odontological experience. This is the difference. This is the magic. And that experience will not only bring benefits to their health, but also great memories. This is why I insist. Integration done with Dentsply Sirona transform lives and smiles.
Yeah, I think the key word here is the experience. You know, patients seeking dentistry, it's a very emotional journey. And so it's important that they're getting the best, and technology helps to bridge the gap and allow them to be serviced into one platform. Danny, I just want to mention that Julie mentioned said she loves the possibilities this digital opens up for you. That your passion is infectious. I think we can all agree that it gets you very motivated and excited for what we do to see a dentist using this product every single day. So moving on to the next question. How do you envision digital dentistry evolving over time as practices begin to leverage technology to treat and services to treat patients? Where are we going? What's next?
In the old days, an odontological chair and X-ray were essential to build a practice. Nowadays, the scanner, CBCT, milling machine, softwares, 3D printers, vacuum machines, among others items are indispensable. So that you can have an idea. Nowadays, my patients find my clinic on Google and schedule their appointments saying, I would like to see Dr. Daniela to make a prosthesis using CEREC in a single session. Or I would like to make an aligners using a digital scanner. The patient's profile has changed. Therefore, the dentist's profile must change as well. Now, the patients have a level of knowledge and demands that are much bigger. And the practice that can't advise in digital dentistry will be left behind and sadly lose a lot of patients. Because once patients have done treatments with CEREC, they will not go back to traditional systems. I confess that Dentsply Sirona equipments and consumables arrived at my clinic to stay. Also, that they pushed my growth and development in both aspects of my life, personal and professional. My team of dentists got bigger, my staff got better, and my practice expanded beyond anything I could have expected. For the future, in the long term, I hope scanners get smaller, lighter, faster, more precise, and wireless. That milling machine get to a higher of excellence and the end results with less drill wear. That the tomographs become more precise and take less space. And that Dentsply Sirona keep investing in technology development and clinical education. Clinical education is essential for me.
You know, the fact that you said that the profile of the patient has changed is, I've never thought about it that way, because we're always centering the dentist, but you're right. Patients are arriving with more information. They're more educated about the technology, the way that, I mean, I'm a patient, you're a patient, people are patients. We live our lives in a highly connected, fast pace. Why would we expect differently from our dental offices and other services that we provide? But yeah, we hope that we can make the scanners smaller and faster and lighter. So take note, everyone in the call who has influence on that. So you shared a lot of, I would say, upsides into what the integrated workflow has. But I'm curious to know what is missing from your integrated workflow and what can Dentsply Sirona do better to support that, to fill that gap?
I believe that I closed a circuit of equipment for my integration workflow with CBCT, OmniScan and PrimeScan, PrimeMU and MCXL, CEREC Ortho, CEREC, Connect in Lab, Vacuum Machine, X-ray, Smile, Sinus Chair, and Speedfile. For my business plan, these equipments are a must, and they allow me to work with all odontological specialties, mainly prostheses, implants, orthodontics, periodontics, endodontics, and surgeries. And now, I must tell you that buying the equipment is not the biggest challenge, but teaching, improving, and getting your team on the same page, ready for digital dentistry. And on doing that, Dentsply Sirona is also great because their clinical education makes all the difference in training my team. And finally, about where and how Dentsply Sirona could improve. In my opinion, Dentsply Sirona already is the greatest in the world. So keep doing what you do best, innovating and integrating new technologies to the digital dentistry universe. I can tell you, I love Dentsply Sirona. Thank you so much, my friends.
There you go. Absolutely incredible. And thank you so much for this knowledge that you've shared with us and your passion. I think clinical education is critical, as you mentioned. We can develop the technology, but we need to be able to teach it. And leveraging Dentsply Sirona Academy faculty like yourself, we hope to spread these workflows to more dentists. So did you have any last words you would like to share with us before we wrap up?
Não entendi, Dani.
Ela perguntou se você tem algumas palavras finais para dividir com as pessoas.
Excuse me. Thank you so much. It was an excellent experience. I love I love working with Dentsply Sirona. I love to be a KOL, to be a teacher. I love working with clinical education, and I believe that Dentsply Sirona is the best in the world. Count on me. I am here with you.
Thank you. And
Thank you so much.
And on behalf of the Digital Platform and Solutions Group, thank you for your time today. And if there are any follow-up questions, I'll be sure to send them over to you from the team. And thanks everyone for joining. Thank you, Dr. Aggio.
Thank you so much.
Thank you.
Thank you very much. It was great.
Thank you. Thank you.
Bye-bye.
Bye-bye. Thank you, Jen. Thank you, guys. Thank you. Bye-bye.
Muito obrigado.
Obrigado. Tchau. Good afternoon. Good morning. Thank you. Bye-bye. Boa tarde. Tchau, tchau. Thank you, Jen. Thank you.
Yeah.
Thank you, Jack. Thank you, Dani.
Obrigado. Tchau, tchau.